Hey future nurses, welcome to Nursing Survival. I'm Nurse Camille. If this is your first time listening, then thanks for coming. This podcast reviews all the important information about medical conditions specifically for nurses. This will help you survive nursing school and fly through the NCLEX. You can find the study guide that goes along with this podcast on nursingsurvival.com. I've created several study guides for each condition that'll help you really understand the information. New episodes come out weekly, so add me to your favorites. You can also follow me on Twitter, Facebook, or Instagram. Let's start studying.
On this episode, we're going to be talking about Addison's disease. Addison's disease is a disease in which the adrenal glands do not produce enough hormones, or adrenal gland insufficiency. The adrenal glands are located on the top of the kidneys. They produce the hormones cortisol, aldosterone, and androgen. The pituitary gland stimulates the adrenal glands to produce these hormones. Cortisol regulates the body's reaction to stressful situations, such as exercising. It also assists in blood pressure regulation, cardiovascular function, water regulation, maintaining the blood glucose, and metabolism. Aldosterone plays a role in the regulation of sodium and potassium, water regulation, blood pressure control, and blood volume. Androgen is a sex hormone that controls secondary sexual characteristics such as body hair growth. The adrenal gland may have insufficiency due to itself being damaged or due to another factor causing it not to be able to produce enough hormones. When the adrenal gland itself is damaged, it's called primary adrenal insufficiency. This could be because of an autoimmune reaction where the immune system attacks the adrenal glands as if it is a foreign invader. Other causes could be tuberculosis, infections, or even cancer. Primary adrenal insufficiency is the most common cause. Symptoms of primary adrenal insufficiency normally do not develop until the adrenal cortex is almost completely damaged. Secondary adrenal insufficiency occurs when another part of the body causes the adrenal gland to be unable to produce enough hormones. Adrenocorticotropic is a hormone produced by the pituitary gland. It stimulates the adrenal glands to produce their hormones. If the pituitary gland is damaged, then it will not produce ACTH, which means the adrenal glands will not produce their hormones. Corticosteroids such as prednisone may also cause secondary adrenal insufficiency. They can cause the adrenal gland to stop producing the hormone cortisol. When the patient stops taking the corticosteroids, their body may need time to adjust before it will start producing the cortisol on its own. Other factors that can contribute to secondary adrenal insufficiency include cancer, trauma, as well as acute blood loss after childbirth. Keep in mind that primary adrenal insufficiency is the adrenal gland being damaged. Secondary adrenal insufficiency is an outside influence causing the adrenal gland not to be able to produce the hormones. Diagnosing Addison's disease involves lab tests and imaging tests. Blood tests may look at the sodium and potassium levels. Remember that the adrenal gland produces the hormone aldosterone. It works on the kidneys to influence the retention of sodium and the excretion of potassium. Since a patient with Addison's disease may have low aldosterone, it may lead to the body losing sodium in the urine and retaining potassium instead of excreting it. Hyponatremia is low sodium and it is less than 136. Hyperkalemia is a high potassium that is greater than 5. Another lab that may be altered with Addison's disease is cortisol. Cortisol is the stress hormone and is produced by the adrenal glands. Cortisol levels vary throughout the day. Blood testing is usually done twice in the same day. The adrenocorticotropic hormone, ACTH, also varies throughout the day. Lab tests may also be taken twice in one day. ACTH levels are normally high in the morning and low in the evening. Patients with Addison's disease may have low ACTH levels. An ACTH stimulation test is done to measure the body's ability to respond to ACTH by producing cortisol appropriately. Remember that ACTH is produced by the pituitary gland and stimulates the adrenal glands to produce hormones. For an ACTH stimulation test, the cortisol level is tested after an injection of synthetic ACTH. It is compared to the blood levels that were taken before it was given. Cortisol levels should increase after an ACTH injection. A normal result is a cortisol level greater than 20. People with Addison's disease may have a low level. An insulin-induced hypoglycemia test measures the blood glucose and cortisol levels after the administration of insulin. In healthy patients, the glucose level will fall and the cortisol level will increase. This test will help identify if the pituitary gland is involved. The patient may experience uncomfortable symptoms of hypoglycemia, including sweating, palpitations, and even loss of consciousness. A computerized tomography or CT scan may be conducted on the abdomen to assess the adrenal glands. A CT scan of the brain may be done to visualize the pituitary gland. A CT scan uses a combination of X-ray and computer processing to visualize inside the body. An MRI may be done on the adrenal glands or the pituitary gland. It can help find tumors or growths. Signs and symptoms of Addison's disease vary from person to person. Many will not have any symptoms until the adrenal cortex is almost completely compromised. Symptoms include fatigue, tiredness, fainting, decreased appetite, and weight loss. GI symptoms include nausea, vomiting, diarrhea, and abdominal pain, hyperpigmentation or darkening of the skin. Vitiligo is white patches on the skin. The patient may have black freckles that normally appear on the face and arms. They may have hypotension, which is a blood pressure less than 90/60. Bradycardia is a heart rate less than 50 beats per minute. They may have a salt craving. Remember, aldosterone influences sodium. An increased urinary frequency may also be a symptom. Dehydration. They may have hypoglycemia, which is a blood sugar less than 70, muscle or joint pain or weakness, cognitive defects such as irritability or poor concentration, depression. They may experience hair loss on their body, sores in their mouth. Women may have sexual dysfunction. Addison's disease can cause a lot of complications. Addisonian crisis is a serious condition that occurs when the cortisol levels are critically low. It is a sign of acute adrenal failure. Cortisol helps the body to respond to stress. Signs of an Addisonian crisis include extreme weakness, confusion, pain in the extremities, severe abdominal pain, sudden severe back or leg pain, vomiting, diarrhea, dehydration, sweating, fever, chills, dizziness, slurred speech, loss of consciousness, delirium, severe hypotension, tachycardia, which is a heart rate greater than 100 beats per minute. Hyperkalemia is a high potassium greater than 5. Hyponatremia is a low sodium less than 136. Addisonian crisis can lead to life-threatening shock. It can also cause seizures, coma, and even death. Patient education for Addisonian crisis includes ensuring that the patient knows the signs and symptoms of a crisis. Treatment is usually an injection of hydrocortisone. Another complication of Addison's disease is hypoglycemia. It is a blood glucose level of less than 70. Signs of hypoglycemia include dizziness, extreme hunger, headache, and confusion. The patient may have difficulty concentrating or completing a task. If it becomes severe, they may lose consciousness or even have a seizure. Hypotension is another complication. It is a blood pressure less than 90/60. When the patient is hypotensive, their body cannot receive enough blood and oxygen. The patient may also become depressed. Treatment of Addison's disease involves hormone replacement therapy. Corticosteroids are used as a cortisol hormone replacement. Hydrocortisone and prednisone are examples of corticosteroids. Side effects may include weight gain, hypertension, mood swings, osteoporosis, and hyperglycemia. It may also increase water and salt retention, which could be beneficial for a patient with Addison's disease. When taking corticosteroids, monitor for GI bleeding. The patient may need to carry identification and information about their medication. Fludrocortisone acetate is used for aldosterone hormone replacement. Side effects include GI upset, menstrual changes, increased risk of infection, and weight gain. It may also cause water and salt retention. In secondary adrenal insufficiency, the underlying condition needs to be treated. If left untreated, Addison's disease may progress to Addisonian crisis. The patient may need to carry emergency injectable corticosteroids to help prevent a crisis. The patient may also need to incorporate more salt into their diet as well as manage their stress. Nursing considerations for Addison's disease involves helping the patient manage their symptoms. Remember that Addison's disease can be life-threatening. Medical care may include the administration of hormone replacements. They may need IV fluids, such as 5% dextrose or D5, which will help maintain blood glucose levels. They may need normal saline, which will help with sodium levels. Insulin or sodium polystyrene, also known as K-oxalate, may be given to lower potassium levels. Remember that aldosterone influences the excretion of potassium, so the patient may develop hyperkalemia. Antipyretics may decrease fever. Patients diagnosed with other autoimmune diseases, such as Graves' disease, Crohn's disease, or type 1 diabetes, are more likely to develop Addison's disease. Assess the patient for signs of dehydration. This can include low urine output, less than 30 milliliters an hour, dry mucous membrane, or poor skin turgor. In women, the deficiency of androgen can lead to loss of body hair and lower their sex drive. However, in men, androgen is produced in the testes, so they do not experience these symptoms. Patients with secondary adrenal insufficiency will not have hyperpigmentation and are less likely to develop dehydration or hypotension. However, they are more likely to have hypoglycemia. Patient education involves medication administration. If you have a patient taking corticosteroids or anticoagulants, they may develop secondary adrenal insufficiency. Educate them on the possibility, as well as the signs and symptoms of Addison's disease. Instruct patients with Addison's disease to incorporate more salt into their diet when they are exercising, outside in the heat, or if they experience vomiting or diarrhea. Tell the patient to contact the medical team when they are ill because their medications may need to be increased. Patients need to take their medications at the same time daily. Do not skip the dose. Missing medications can lead to Estonian crisis. Medication will be taken for the rest of their lives. Steroids should be taken in the morning due to stimulation of the nervous system. They can cause insomnia. Inform the patient that stress can increase their symptoms. Instruct the patient to carry a medical emergency card or bracelet to alert people of their condition in case of an emergency. They should also alert them of the medications they are taking. The patient may also need to carry emergency corticosteroid injections in case they have Estonian crisis. Thank you for listening to this episode of Nursing Survival. Find me at nursingsurvival.com for more study guides. I also have podcast videos on YouTube. Sign up for emails so you can be the first to find out when new study guides come out. Thank you.